Hello, welcome to the Hospital and Clinical Pharmacy. Myself, Miss Malvi Rajendra Bhavsar, M.Pharm in Pharmaceutics. So today we are going to deal with the new topic, that is pathophysiology and symptoms of disease. Part 1. So after watching this video, student will be able to learn pathophysiology of different diseases, etiology, sign and symptoms. So first we'll start with the introduction. In study of disease process, we can define a disease as a form of a life beyond the limits of normal. A normal individual is one having ability to meet the demand placed on the body, to adapt to this demand or changes in the external environment in order to maintain reasonable consistency of internal environment. Then, this is a pathophysiological process which is involved. It is illustrated in the figure 4.1. So, pathophysiological process starts with identification of a cause or etiology, then study of primary pathology or biochemical pharmacological structure, then whole organ or system of functional pathology, then sign and symptoms are observed. But after primary pathology, if there is a complications, that first complications are observed, then that process continues with sign and symptoms. Even sometimes after primary pathology, it is necessary to study the secondary pathology if complications are observed. And then sign and symptoms are again observed for the disease. So this is how the pathophysiological process involved to identify the cause of disease and pathophysiology of that particular disease. Now, to understand the concept of disease process, we have to discuss some important terms related to pathophysiology. First term is etiology. It is the assignment of a cause or reason of phenomena. A description of etiology of disease include identification for those factors that provokes the particular disease. Thus, the tubercle bacillus is designated as the etiologic agent of tuberculosis. Other etiologic factors in the development of tuberculosis include the age, nutritional status, etc. Then second term we are going to study is pathogenesis. Now, pathogenesis of the disease refer to the development or evolution of disease. Thus, pathogenesis of tuberculosis would indicate the mechanism whereby the invasion of a body by the tubercle bacillus ultimately leads to observable abnormalities. Then manifestation. Manifestation are the changes which are observed during the disease process. They can be expressed by the following terms. First term is sign and symptoms. The symptoms which are subject to feeling which can only be reported by the patient to an observer. Means only patient can report his feeling to the observer. That feeling is nothing but the symptoms which patient feels. Then, whereas in the manifestation of the disease, when objectively identifiable changes are involved, these are termed as sign of disease. Nausea, malaise and pain. These are the symptoms, means these are the feeling reported by the patient to an observer, while fever, reddening of the skin are the signs of disease, means these are the identifiable changes which has occurred or involved during the manifestation of disease. Then second, it is lesion. A demonstrable injury to the organ produced in course of disease is referred as to lesion. Then comes sequel. It is the outcome of a disease that is sometimes referred as a sequel. For example, the sequel to inflammatory process in the given tissue might be a scar in that tissue. D. Complication of a disease. It is a new or a separate process that may arise secondarily because of some changes produced by original entity. For example, bacterial pneumonia, that may be complication of viral infection of the respiratory tract. Then now we will start with the first disease, that is tuberculosis. It is an infection caused by Mycobacterium tuberculosis. Mycobacterium tuberculosis is a rod-shaped organism that requires high oxygen tension for the optimum growth and produce no toxin or enzyme. The main means of spreading tuberculosis between individuals is by coughing and sneezing. The sputum of actively infected patient is contaminated with many bacilli. These droplets become airborne, which are inhaled by others. If the organism is inhaled, droplet reach the bronchioles or alveoli and it develops into tuberculosis infection. But if the bacilli only reach the upper bronchi, they get eliminated without any subsequent infection. Now this is pathophysiology. The bacillus is an aerobe, that is, it is requiring oxygen for its growth, that is aerobic microorganism or aerobic bacteria. Then high oxygen tension apices of the lung offer an ideal environment for their growth. Then tuberculosis may affect any organ of the body. The infecting organism gains entry into body via lungs. And this is nothing but the primary tuberculosis. Now, from the lungs, infection will spread to other organs by the way of lymphatic system and by the bloodstream. The bacillus, then it is seated in the high areas of a high oxygen tension, that is kidney, brain, lymph node, epiphysis of a long bone, etc. After several weeks, cellular immunity develops. It involves a lymphocyte, giant cells and macrophages. Again it develops granulomas. At this stage, the infection becomes dormant and host immunity prevents its spread. The lesion may be walled off by the production of fibrous tissue and calcification organism may remain inactive forever in the host, or they may be again reactivated. Then manifestation of tuberculosis, signs and symptoms. The signs and symptoms are discussed as below: primary tuberculosis, pulmonary tuberculosis and miliary tuberculosis. In primary tuberculosis, incubation period of bacteria is 4 to 9 weeks. It does not produce many signs and symptoms. In this stage, there is only mild fever, malaise and tuberculin hypersensitivity. In pulmonary tuberculosis, symptoms are first fever, which is up to 40 degrees Celsius in late afternoon or evening, and then sweating at night. Fatigue, malaise, irritability and weight loss. Then cough early in the morning with green or yellow sputum with a blood spot. Blood is present generally due to the ulceration of bronchial mucosa. If the pulmonary artery in tubercular region breaks, massive hemorrhage occurs and it may be spread to pleural membrane or pericardium, and it causes inflammation in the region where it spreads. Then miliary tuberculosis. Lesions are found in the lymph nodes, kidney, meninges, fever, spleen, bone marrow and other organs which do not have high oxygen tension. In this stage, dyspnea, weight loss, fatigue, weakness, fever, night sweat, GIT disturbance are the common symptoms. Then second disease we are going to study is hepatitis. It is the inflammation of the liver caused by hepatitis. It includes viral and bacterial infection. It is autoimmune disorder and exposure to the chemical. There are 4 types of viruses causing different type of hepatitis. First is hepatitis A virus, which causes hepatitis A. Hepatitis B virus, which causes or responsible for hepatitis B. Delta virus and non-hepatitis A and non-B hepatitis. Hepatitis A virus, it is an RNA virus usually contracted by oral fecal exposure to air of infected individual. Hepatitis B virus, it is a DNA virus generally acquired by parenteral exposure to contaminated blood product or infected syringes and needle. And hepatitis delta virus is defective RNA virus that can be replicated only in the presence of helper hepatitis B virus. Therefore, delta virus can affect only person with the hepatitis B. Now this is pathophysiology. First, hepatitis B virus enters the body and replicates in the liver cell. These cells or their fragment get incorporated into liver cell membrane. It produces humoral antibodies IgG and IgM that are formed against the viruses. These antibodies attack the foreign plasma membrane. Thus, immune system damages the liver. Circulating immune system complexes and complement activation cause further systemic manifestation. Then signs and symptoms. In hepatitis A, the initial symptoms are anorexia, fatigue, nausea, vomiting, paralysis, headache, photophobia, changes in the sense of smell and taste, chills, fever, pharyngitis and cough. Occasionally, arthritis occur. Then 1 to 4 days before jaundice, the urine darkens because of bilirubinemia and stool color even lightens. Then next disease is rheumatoid arthritis. It is a chronic systemic disease characterized by inflammation of connective tissue. Rheumatoid arthritis is autoimmune disease. In this disease, body immune system no longer accepts certain body protein and react as if they are foreign antigen and produces antibody against them. It is observed that patient's body considers human gamma globulin as an antigen and produces antibody against them known as rheumatoid factor. The antigen reacts with antibody to form immune complex which then react with the complement. The complement is a series of protein which help to stimulate the inflammatory process. Thus, immune system complex react with the complement in the joints which leads to the inflammatory responses. Sign and symptoms or manifestation. First, it is showing fatigue, anorexia, that is loss of appetite, weight loss and fever, inflammation of peripheral joints. Most frequently, the small joints of the hands and feet and wrist larger joints may also be involved. Morning stiffness is a common symptom. The stiffness generally lasts for more than 30 minutes and may last for many hours. Shows chronic inflammation of joints. Deformities may develop mainly in the finger and neck. Around 20 to 30% patient shows the formation of rheumatoid nodules. They occur commonly in the elbow or along the extensive surface of the forearm. They are formed round or oval masses which are usually movable. Inflammation of organs like heart, eyes and lungs may occur. Then cardiovascular diseases, in that first is atherosclerosis. It is a patchy thickening or a hardening of the arterial wall. It is characterized by streaks of cholesterol and other lipids and later by atheromas. Atherosclerosis is involved in development of ischemic heart disease and cerebrovascular disease. Pathophysiology, mechanism of atherosclerosis development is not well understood. The process starts at the ischema, that is inner layer or arterial wall. Platelet aggregation, endothelial permeability changes and fibrin deposition leads to formation of atheroma. There is fibrosis, calcification, ulceration and thrombosis which occurs. Smooth muscles proliferate in the ischema along with the lipid accumulation. There is LDL, which is enriching cholesterol and poor in triglyceride, accelerate atherosclerosis process. Whereas HDL, they have high protective effect against atherosclerosis development. This is because they transport cholesterol from peripheral tissue to the site of metabolism, that is liver. Then sign and symptoms. In severe cases, it may cause angina pectoris, myocardial infarction, ischemic renal diseases, peripheral vascular diseases. May show pain in legs which reduces on resting. Pain in the leg is severe at night when blood is not flowing due to gravity. It causes loss of hair on the legs, weakness of leg muscles, extreme sensitivity to cold. Atherosclerosis of mesenteric vessels may cause abdominal pain. Bowel infection may occur in thrombosis of these vessels. Thank you very much friends for listening, your patience listening. We'll meet in the part 2 of this same topic. Thank you.